Welcome to today's Power of Knowing, caring for veterans, serving those who have served. Understanding comes from knowing. Each veteran and family member deserves to know what benefits, services, and resources are available to them and how to access them. This webinar will provide information useful to all veterans and family members, especially as veterans age or have serious illness. This free webinar series is called The Power of Knowing and was created by the AuthoriCare Collective, which empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome Risa Hanow. Risa Hanow is the clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. It is my absolute pleasure to introduce our panel for today. First, Pat Gibbons. Pat has over a 50-year nursing career that has been focused in home care, HIV, hospice, and community-based care in a variety of roles. She was the director of Beacon Place, an inpatient hospice unit, for 20 years, and in theory retired in 2016, but she returned to work part-time, as she does currently as an intake nurse at Pace of the Triad. And she is also extremely involved in volunteer organizations, including Mustard Seed Clinic, and continues to support Triad Health Project. Welcome, Pat. Shannon Pointer. Shannon is a certified hospice and palliative care nurse, and she has over 20 years of experience in nursing. And she started as a school nurse in 2004. And it was there where she learned the importance and value of good communication, collaboration, and strong interdisciplinary teamwork. And that certainly served her well as she made the transition in 2013 to the home health, hospice, and palliative care field. Currently, she is the Vice President of Hospice and Palliative Care for the Association for Home and Hospice Care of North Carolina. And prior to that, was the director of the facility teams for AuthoriCare Collective. Shannon is passionate about advanced care planning, veterans outreach, and education. And Robert Shelley. Robert joined the Marine Corps right out of high school in 1984. During his military career of 21 years, he was stationed at various bases along the East Coast and served in multiple roles, including serving as an intelligence specialist. After retiring from the military in 2005, he attended college and then started his post-military career at the North Carolina Veterans Home in Fayetteville. Robert has served as the Veteran Service Officer and currently is the Director of Veteran Services for Guilford County. So you can see we have a strong and wonderful panel with us for our conversation, but we also know that we have participants that we want to get to know a little bit more about. And the best way for us to do that is to look at the polling question. You can see it on your screen. So this polling question is anonymous and it is multiple choice. So you can check as many as apply to you. A veteran, family member of a veteran, patient, caregiver, an advocate, a healthcare professional, and a human service professional. I love seeing the numbers and the percentages as you answer, and very much appreciate you taking the time to do that. Gives us a nice sense of who is joining. Many family members of veterans are joining us, and many healthcare professionals and human service professionals, and many caregivers and advocates. and also a good number of veterans. So really a great cross-section, and exactly who we want to participate in our conversation. So thank you so much for doing that. Gives us a good sense as we begin our conversation today, which we hope will be very meaningful for all of you that are joining us today. As we begin our conversation, I want to invite you at any time to make use of the Q&A box on the Zoom screen. We will try to answer just as many of those questions as we can. And I want to make a note at the beginning of our conversation that we're going to mention a number of resources, and know that you will get an email tomorrow that will have links to the resources that we mentioned. So don't feel the need to take notes while we're talking. Just really be a part of our conversation. And to that end, Robert, if you could get us started. So I said that you serve in the role of a veteran service officer. Maybe you could explain to us what exactly you do in that role and how it is that you help veterans and the family members access benefits, and what some of those benefits are that are available.
Well, thank you very much. We'll start off with what do we do actually. We advocate for the benefits for our veterans. The VA system could be a symptomatic program where many veterans can't articulate the program itself. That's where your veteran service officers come in the 98 counties in North Carolina. We assist veterans with disability compensation for injuries, illness, and sickness that occurred on active duty. There's also a program for veterans pension for those that served during a wartime period and meet the financial or income levels. We assist not only the veteran, but the family members once that veteran passes with their death benefits. That could be burial or dependent indemnity compensation or widow's pension. The only thing that we require when you come into a veteran service office is just a support documentation. We complete all the applications for you and explain the program and the process of how it works. We also work with the tax exclusion for veterans that are over 100% permanent and total. We work with the helpless children of veterans. Also, we specialize in the veterans license plates for their particular military branch they served in a partial disabled license plate and the disability license plate. But there are some veterans that applied for benefits before and were denied. We do work on appeals and supplemental claims, and we walk you through the entire process, not only so that you understand, but you gain the knowledge on how to work within the VA system and what supporting documents they're looking for, so that as a team, we can get those benefits that you rightfully deserve.
That's wonderful. And what a wonderful resource. And as you said, available across North Carolina and I'm sure across other states as well, for those who might be joining us. So Shannon, when we think about, we now maybe look specifically at the veterans and family members of veterans who are aging, might have a serious or a terminal illness, and thinking about additional particular resources and services that are available, including We Honor Veterans and other helpful things that might be able to really make a difference in many people's lives.
Yes, thank you so much, Risa. I'm so excited to be here with everyone today and to share about some of the work that we do through the Association for Home and Hospice Care of North Carolina. I am the vice president for hospice and palliative care with our association, and we also manage the South Carolina Home Care and Hospice Association. So I get to do this wonderful work across 2 states. Our mission is simple. It's to provide education, resources, advocacy, and leadership to our members as a nonprofit trade association. So we have membership that includes home care, home health, hospice, and palliative organizations. When I began work at the association, this was in December 2019, one of the first things I did was sit down with our president and CEO, Tim Rogers, and I said, you know, I have a strong desire to strengthen our ability to do outreach related to veterans. And he was so supportive. He said, go for it. So we did it. And we started 2 statewide hospice veteran partnerships, one in North Carolina and one in South Carolina. And our association is recognized as a hospice veteran partnership through the National Hospice and Palliative Organization, or NHPCO. And so through this We Honor Veterans program that is through NHPCO, we work with hospices all across both states that are participating. And one of the links that Risa will be sharing is a link to the We Honor Veterans program, so you can learn a little bit more about it if you'd like to. So these partnerships open up so many opportunities to work together to better serve veterans and their families. Hospice organizations can choose to participate in the We Honor Veterans program through NHPCO by signing up and completing partner level activities. So there are different levels, anything from a recruit level starting out all the way to level 5. This is something that requires an immense amount of dedication on the part of the organization that agrees to participate. They have to be committed, and they can't just complete one of the levels and stop. It has to be ongoing participation. And along the way, this is the best part about it, the relationships. All along the way, that's what's happening. We're building relationships to better serve veterans and their families. So these relationships continue to grow off of conversations, learning from each other, finding ways to help, and ultimately helping to provide better care to veterans and their families, and working with those in our communities who serve veterans to ensure that everyone understands and is aware of resources that are available. Unfortunately, that happens a lot. There are a lot of times where we hear, I wish I had known about those resources. I didn't know. And so being a part of a hospice veteran partnerships means that we're bringing together organizations that help to serve veterans in communities, hospice organizations, so that when the time comes that we need to ask, you know, I wonder if there's a resource available. How do I connect to learn more? We're not wasting time. We're working together now. So when and if we need to reach out, we know who to call. We build these relationships with each other with that ultimate goal in mind of better serving veterans all across our state. So I love what I do. I feel blessed to have this opportunity to work with so many agencies such as Veteran Service Offices and Robert. You know, having that relationship now means that if I need to call Robert tomorrow because I have a veteran in need or a family that's asked for where to go or how to reach out, I know I can pick up the phone and call him. And that's really what's most important, to be able to work together to help veterans when they need us, help their families when they need us. We might not have all the answers, but we have relationships and we can work together to do the best job possible.
Thank you. I know at AuthoriCare, as a We Honor Veterans program, how important it is that we know right from the time of admission which patients are veterans and families, so that we can really tailor our care. And Pat, I want you to help us understand some particulars about, we know that every veteran's experience is different. And we know that there are differences between veterans who served at different war times, and also whether they were combat or non-combat. What we don't always talk as much about is the impact on the family members, and the importance of that individualized understanding and attention to the veteran, but also to those family members.
And my appreciation to both Robert and Shannon. My contribution to this webinar comes from both my professional experiences, caring for many veterans and their family members at end of life, but also my personal experience as a family member of a veteran. For the clinicians in the audience, understanding the veteran's experience can better inform care. For family members attending, this information may give you an even deeper understanding of your family member's military experience. And for any of the veterans in the audience who may be attending, an appreciation for your service. As Risa said, each era of the military experience is unique, and each veteran's experience is unique to that era. It is their own story as they choose to tell it and when they choose to tell it. And as I said, understanding the veteran experience can inform care. There are a number of things to consider when thinking of the military experience. There are periods of wartime, there are periods of peace, and there are periods of conflict. For example, there was a draft from 1940 to 1973. Men aged 21 to 30 were required to register for the draft. Now, some enlisted, so they had more of a choice as to their military service. During the Vietnam War, this issue became paramount, and the term draft dodgers was commonly used. There were people that left this country so as not to serve, and others certainly served under duress. The other thing that I think is important to understand is each branch of the military has its own culture. And I won't go into detail, but I think that we are certainly aware of, the culture of the Marine Corps, the naval aviators, anybody that watched Tom Cruise and Maverick. There is within the military this culture specific to the area of your service. And that is an opportunity for people to engage in a conversation. But also there is another culture that we should never forget, and that is that of the women who served. Whether they served at home or whether they served overseas. I will put in a plug for PBS. November 10th, PBS is doing a segment called Her War, Her Story, World War II, how women demonstrated their patriotism during the war. And I think it is important to recognize that women served, again, whether at home or whether they were actually in military service, and to recognize that and to honor that. There's a military language. And I will say there's a number of different military languages, some a little bit rougher than the others, but words like deploy, in country, stateside. There's also a military language around the forms that are used, and Robert referenced this, the documentation that is necessary to gain benefits. And if I can just share a story about a form. And this story came to me from the VA hospital in Dayton, Ohio. A man had fallen on hard times and was placed in a facility. But nighttime was a terrible time for him. Nightmares and calling out and all of this. And there was a nurse's aide who worked the night shift, who became connected with this particular person. And the person was disoriented at night, pretty much a loner, no family around, but kept calling out Dee Dee, Dee Dee, Dee Dee. And they actually thought maybe it was a friend of his. But after a period of time, this nurse's aide was piecing together that what he was saying was Dee Dee 214. And for many people in the military, that's a key document to access benefits. It's your military resource, your kind of conditions of discharge. And by doing that, that nurse's aide connected with the social worker at that facility. And they were able to find out that this man was a veteran, was entitled to benefits. The story is much longer than this, but he eventually was placed in a veterans nursing home in Dayton. And as his condition declined, he was admitted to the hospice unit at the the Veterans Hospital in Dayton. And the name of that unit, it is on the top floor, and it's called Patriots Loft. And he died there, but only after he acknowledged that he had been a veteran and it was the only thing in his life that he did right. And the point of this story is he was surrounded by people who understood him and who could respond to his needs as they presented. Now, during wartime, not all veterans will have been in combat, but their service was no less important. And I think this is very evident if you ever watched any of the episodes of MASH and Radar O'Reilly. He kept the place humming. Was he in combat? No. But did he honor his role in the military by providing the service that was necessary in that role? What happens though with some veterans who don't have, and I use this word lightly, the opportunity to serve in combat, is that they actually suffer some guilt, and some suffer survivor's guilt. Again, it is important to recognize that all people that serve met a need within the military at that point in time. Also of note is that there are certain conditions that are attributed to military service during various eras. In World War II, there was chemical warfare. People are familiar with mustard gas and the masks that were required during that time. During Korea, severe cold injuries. And again, I refer back to MASH. They did a lot of episodes on that. In Vietnam, we've all heard of Agent Orange, Hep C. And with Vietnam service, we began to recognize the risk of PTSD, depression, psychosocial distress. During the Gulf War, people experienced exposure to chemical and biological agents. Iraq, Afghanistan, we're all very familiar with the traumatic brain injuries, blast injuries, penetrating wounds, and major mental health issues. Now, for many of the clinicians in the audience today, there is something called the military checklist. And as Risa said, when people are admitted to hospice, the question is asked, were you a veteran? Or are you a veteran? And many other organizations, including the VA, use the same checklist. And the question can be answered very simply, yes or no. But if there is opportunity, the utilization of that checklist will allow you to explore further the veteran's military experience. So it's like, tell me about your experience. When and where did you serve? What did you do? How did your service affect you? And I will never forget the time that I was utilizing this military checklist with a family. And I was speaking with the veteran, and his wife was present in the room. And she listened carefully, and then she very clearly told me, you do realize that families serve also. And again, this is so very important because families do serve, but again, in a different capacity. They're the ones that, as the saying goes, keeps the home fires burning. But also think about military service for those people that are in the reserves. Many people are in the reserves for years, and that's 1 weekend a month and 2 weeks in the summer that they are called away from their families. And so during those periods of service, the families keep things moving at home. But the use of these questions can really help you to engage and to establish rapport with both veteran and the family. The family may know very little about their family member's experience. Many World War II veterans talk very little about their actual experience. You may hear about exploits, but you truly hear about their service experiences. Rather, it was their job at that point in time to go and serve their country. And then when they came home, they picked up their lives. An example of this is a World War II veteran from Raleigh whose family knew that during his service, he was a radio operator. But it was only many, many years later that they learned that he had played a vital role in a major operation that later became known as the Ghost Army. This operation was declassified and those veterans were awarded the Congressional Gold Medal. Another point to keep in mind is the use of the word hero. And I've been reminded a number of times that the heroes are those who did not come home. Also, we have the Korean War that really was considered a conflict. And of course, I'm very aware that the Vietnam War brought up many issues. One of those is the thank you for your service. In this, it is very important that we leave this statement open-ended and make it very personal so that you're able to connect with the veteran. I know that we have many other comments to be made, and so I'm going to stop now and let Risa move us forward.
Thank you, Pat. I appreciate the way you frame the experience of so many. And it makes me think, Robert, about for a veteran or a family member, what is the access point? What do I do? Do I call my county office? Do I have to make an appointment? Can I just walk in? If I'm trying to figure out my first step, my next step, what would you recommend for people?
That's a very good question. And like Shannon was saying earlier, the access point is wherever you are at that time. And going along with Pat is for whoever's talking to the individual to ask the question, are you a veteran? Did you serve in the military? And from that point, with the network and the team atmosphere that we have in Gifford County and many other counties and across the nation, you can do a soft handoff for that veteran, whether our family member, they're in hospice, never utilize the benefits, but there are benefits for aid and attendance or widow's pension that may come into play. Or if you're in a rehabilitation or a nursing home facility, you're asking that question, did you serve? Are you a veteran? There's a benefit there that VA pays if you're eligible for it. So to answer your question in a nutshell, at any point, whoever's talking to that individual can start the process. And now we're going to move along from team A to team B, whether team A is the VA hospital or your local county veteran service offices or your state veteran service office. The second part of that is, I can only speak for Guilford County. We're walk-in 8 to 5, Monday through Friday. I got here in 2018 as a director, and they had a backlog of 3 to 4 months of waiting for appointments. Our veterans don't have that much time to wait. And it's a disservice for any of us to have a veteran wait. So my 5-member team, 8 to 5, Monday through Friday, walk-ins, and there isn't a lunch break. So they eat off schedule sometimes. So we're here for the veteran and the family members. And I like to go back to the networking. And as we talk about these conditions that Pat brought up, Camp Lejeune drinking water is a big factor now. And the reason why I just bring that one up and not the Vietnam era, because there are 14 presumptives for Vietnam. There are roughly 8 for Camp Lejeune, but Camp Lejeune is a hot topic now because there's so many lawyers involved in this, and there's some discrepancy in information. And what we want the veterans to understand, when you're applying for benefits, this is not a legal matter. When you're applying for benefits, at no point as a family member or a veteran should you pay for services. I don't care what state you live in, there is a service offered by the state or the county that is free. And those representatives are accredited reps with the Veterans Administration to assist you to apply for those benefits. And no one should be taking advantage of you and asking you to give them 20% of whatever you receive as a benefit.
Thank you. I think that is, giving people information so that they can be empowered, so that they can tap into a resource that they have earned and that they deserve to have. And Shannon, that makes me think about the work that you do with the networking. And if you could tell us about some of the particular services, the particular individualized interventions with some veterans, with family members, how important that can be to allow a veteran to tell their story, and maybe having some understanding as veterans approach the end of life, some common things and themes that are seen by family members and those that might be involved in providing care.
Thanks, Risa. And I want to kind of go back for a second to some of the things that Robert was discussing. And I think it's important to know that there's really no way, even myself, as many years as I've been involved in this, for me to know every resource that's available, everything possible. You really do have to have those connections, and you want to have those connections because you don't want to miss an opportunity to help someone, to help a family. So the important thing is knowing who to call and how to reach out. And so one of the things that, and I also always love to say this too, I hope this benefits people both personally and professionally, because you may be sitting there and saying, I wonder if so-and-so would qualify. I wonder. Don't wait. Reach out to veteran service offices are great resources. And I can tell you personally, a personal testament to that in helping a loved one that was a veteran who did not know how to get enrolled with the VA, did not know what to do. All I did was make a phone call to the Veteran Service Office and set an appointment and met with them and said, what's possible? That's all you have to do. You don't have to know. You can always reach out. And when you reach out, then you can find out from the Veteran Service Office, what things are actually possible. Same thing goes for the VA. If you need to talk with someone at the VA, having to go through phone lines or trying to get connected, and that takes a lot of time. What I do with the association is working to help agencies across the state to be better connected to the VA medical centers across the state, building those relationships, building those contacts, because they may not need to call the VA every day, but the day that they have a veteran under their care and they want to know what's possible and they need to reach out, they want to be able to do it quickly, efficiently, and not waste time. So that's what we do, and that's what we do well. We help people to make those connections so that there isn't a hesitancy to reach out. And all of the discussion about the military history checklist, that's very important, because that sets the stage. If the veteran and the family want to talk about it, which is also important, making sure that that's something that they want to discuss. If they want to bring it up, then what can we do to ensure that we are helping to connect them to every possible resource available? It's never too late. Home care, home health, hospice, palliative, all along the trajectory. It's never too late to ask, I wonder, and how can I get connected? And that's what I think we do best. And it's really what our mission is. The other thing that we do is education. So all of the things that Pat was discussing. If you're not a veteran or you haven't had that experience, you may not be aware of different wartime periods. You may not be aware of the different service-connected conditions. And so how do we better help organizations to better serve veterans? We can do that through education. We provide education here at the association, and to date, we have not charged any of our members for that education. This is just free education that we offer. We actually partnered with the Salisbury VA, and we did some educational series for our members, and you know, it gave them the opportunity to learn more about things that maybe they weren't aware of. So that empowers them to then have more tools to provide even better care than they're already doing. So education's a big one. Being able to help people access, build that contact database of individuals they can reach out to. You know, I think one of the other things that I just love so much, Risa, and I want to mention it, is Pat mentioned it too. We can always say thank you for your service. And one of the great things that programs do as a part of We Honor Veterans is doing appreciation ceremonies, working together with patients and their families, but also sometimes with facilities like nursing homes, and having these wonderful opportunities where you can show that appreciation, pinning ceremonies. Other ways that organizations show appreciation are things like maybe they already make pillows for their patients, but maybe they work together with someone who says, you know, I'd like to make pillows specifically for veterans. And then that engages volunteerism to support ways that ultimately are saying thank you, showing appreciation, going above and beyond to produce comfort and just to create a wonderful experience. So as I say all of this, I'm reflecting on many of the experiences I had right there at AthoriCare, where I saw some wonderful, happy moments of appreciation and thanks, both from the team, but also from individuals who just couldn't believe that someone would take the time to do these wonderful things for them. So I just feel like I want to just say thank you. Thank you to everyone who all along the journey have educated me. Every veteran that I've ever talked with has taught me something. Thank you to the VSOs. Thank you to all of the organizations that through the work that we do, you might get a phone call from me and you took the time to talk to me and let me tell you about what I wanted to do. And through that, we are building a network of awesome opportunities to better serve veterans. The VFW, the American Legion, Montford Point Marines, every single organization you have really just been open and willing. Every VA medical center, community outpatient clinics. I'm going to leave someone out because I reach out to a lot of people, and I'm just grateful to all of them for being willing to work with us as an association, to work with hospice organizations across the state, really any organization. Also, home care, community care network, working with them for home care, home health, any of the services that are being provided out in patients' homes in our communities. Just can't say thank you enough. And I don't know if that answered everything you asked me, Risa, but I covered a lot there.
No, thank you. And I encourage participants, if you have any questions for the panelists, please make use of that Q&A box so that we can get those questions asked. And Pat, I'm wondering, we know that when somebody is seriously ill, that they are going through changes, both physically and emotionally, spiritually. And if you could speak some to the reality for some veterans and also family members, this might be the first time that they're hearing about an experience, or there might be a healthcare intervention that causes distress that we're not connecting, maybe because of an oxygen mask or something, and just helping us understand both for the veteran, the family members, and how it is that we can keep that in mind so that we're providing the best care possible.
Exactly right, Risa. And I think that we, as you said, we all know
that a time of distress, critical illness, grief, a lot of the emotion of military service, and oftentimes it is wartime military service, has been suppressed, but it comes to the forefront at these very stressful times. And excuse me, one of those is this whole issue of moral injury. And in that is a suppressed feeling that could not be reconciled. And many veterans have experienced this. And again, this is oftentimes those veterans who have served during wartime. And one of the things that I say is that by practicing informed care so that we have an understanding of this possibility, and by the fact that we have completed a military checklist, we may be able to help that veteran, never to reconcile that because it will not be reconciled, but to bring he or her and her family or his family to a point of recognition and acceptance. And by that I'm saying, I am a firm believer in not medicating away distress. The role of clinicians is very important in helping them to come to grips with that and to recognize that that was part of their service and a necessary part of their service. The other thing is that there are oftentimes triggers that happen when a person is seriously ill. And again, the family may not be aware of this, nor the clinicians. Some of those triggers, as you mentioned, are things like using an oxygen mask with somebody that has had to use a gas mask. It may bring up that again. Some of the other triggers are sights, sounds. I know of a veteran who walked through a tropical rainforest on vacation and totally decompensated because it brought back all of those issues of his military experience. This is where you utilize a team, and every care system has a team. Your social workers, your chaplains, your clinical people, your physicians, your social workers. Within the VA system, I've seen incredible things happen with the VA teams, again, because they are aware and willing to listen. The one last thing I want to say is that I think it's very important as we deal with veterans and want to hear their stories, it may be our need to hear their stories and not their need at that time. So it's very important to be patient, to be present, listen to the story, but also listen to the silence.
And Robert, I have two questions. The first one I think is about mental health. When you were mentioning the different services that you help veterans learn about and apply for. Can you talk to us some about mental health services that are available and recognizing the particular needs of veterans and how one goes about accessing those services?
That's a very great question. And to the clinicians out here, mental health is not just a veteran's issue. So therefore, what you have is a community that has impacted mental health to the point where there are not enough psychologists, psychiatrists, or specialists to accommodate the mental health issues we have. With the Veterans Administration, they do a very good job. What I would stress to the veteran or the family member is not just trying to get an appointment with the psychiatrist, is that you can go to the VA hospital when you're having an episode, or you're thinking you're having an episode from one of those triggers or stressors that Pat was talking about, and you need to see someone right now. They will accommodate that right now, because what we don't want to happen in our community is for an engagement with law enforcement, because that could turn out the very wrong way. But also through the VA, we use a nationwide network. You may be talking to someone in Texas, Oklahoma, because we don't have the population in our veterans hospital to care for each and every veteran that has a mental health issue. I think one of the links that we're going to share is the mental health hotline that any one of our veterans, our family members can call into to get our veterans assistance. I know here in Greensboro, we just recently opened up the Gifford County Behavioral Mental Health Facility and a youth facility that's located on 3rd Street here in Greensboro, North Carolina, which we actually personally walk some of our veterans over to, because it's right outside our back door. We're not mental health physicians or psychiatrists, but we understand the stressors. We understand the triggers that some of our veterans are going through and the episodes that they're having. And it's just vitally important that we get them the assistance that they need right then, and not prolonging this, because something negative can come out of it. And it's so important for us to take care of it before, Pat was talking about triggers with the gas mask and the face mask. It's unbelievable that we have veterans that served in Vietnam. We have veterans recently in Afghanistan and Iraq. And you wouldn't believe that the American flag is a trigger for some of our veterans, because there were so many caskets draped in the American flag that when these veterans see the flag, it triggers them, and it causes them the mental health conditions and the symptomology they go through. These things don't have to be combat related. It's that you're in a combat field where injuries and illness or sickness are taking place. And what we would ask the family members is to see these and recognize these symptoms and reach out and get the veterans some assistance. We're going to tell you, as a Marine of 21 years, I'm okay, I'm fine. You can't take that and become an enabler. We can start the process at home and move it along to the VA hospital or Cone Health. And what's unique about Gifford County that I learned over the past 3 weeks, there are a great number of mental health facilities here that, like Shannon said, I didn't know existed. But doing Out of the Darkness walk, I found all these wonderful places, and that serve veterans as well, not just our community who didn't serve.
Thank you. And we know that just recently 988, which is a national hotline for people who are in crisis or might have some thoughts of suicide. So we know that that is always an immediate option for people as well. The other question, Robert, I'm thinking about, you mentioned aid and attendance, and you mentioned widow benefits. And I know that for having worked in hospice at AthoriCare for so long, sometimes there are questions about, how long does it take to apply? And is there a waiting list? And how long will it take until I get benefits? And, some of these really practical things of people seeking information. And I don't know if there's an actual exact answer, but if you can, help us understand sort of the process and the time that is involved.
I'll start with this. When dealing with death benefits, you have several categories. We'll deal with the first one as being that the veteran was not 100% and was not had 100% for 10 consecutive years, because those are easy. The answer is it normally takes VA 4 to 6 months to respond to some of these claims. Now, some of those claims may take longer than that because the issue is we don't have all the required supporting documentation. And the supporting documentation is very important when you're applying for the death benefits. For dependent indemnity compensation, which has no income barrier, is because the veteran died from a service-connected disability, which has to be listed on the death certificate. What I would say to some of the family members, I know it's a traumatic time that you're going through in this process, but prior to reaching out to anyone at this point, we would ask that your first stop would be that veteran service officer so that they can contact VA. And if the veteran was receiving benefits, before they close his account for information gathering, that we can get the information that we need if they haven't been seen in our office before. In Guilford County, what we've done in the past, and which is a great benefit to our veterans, I just did one 2 weeks ago. There are veterans that have, as someone mentioned, PTSD, and they died from something that wasn't service connected. But I learned the vocabulary from being in Fort Bragg. Failure to thrive could be a mental health condition. So what you do is you get the examiner who certified the death to add PTSD or any other service-connected disability the veteran had to the death certificate as a contributory factor, which helps out. Now, if a veteran was 100% for 10 consecutive years, you could apply for the benefits today and have a check in less than 2 weeks, and you're already approved for the benefit. So it's different ways you go in, but for the most individuals, it's the 4 to 6 month wait. VA does a wonderful job now of processing claims. Just because you filed it in North Carolina doesn't mean it's going to be worked in North Carolina. So we look for the shortest lane so we can process that application in an effective and efficient manner. Now, another part of that is if the veteran is terminally ill, you can expedite claims as well on the behalf of a family member, whether it's for aid and attendance or is for one of the other programs that we have. So there's a means to expedite as well.
Great. That's very important for us to know that there is a path for those who are terminally ill. Somebody has asked a question whether is there within the VA a 1-800 like an information and referral number, that a national number that people can call for information and referral, or it's really I know we're going to share links to the different VA resources, but I didn't know if there was a particular line for information and referral.
Yes, ma'am. If an individual want to ask questions of the VA, and I'm going to say this very lightly because this number is universal, 1-800-827-1000. What I would recommend to any family member, a friend, a spouse, a child, reach out to your local veteran service office, whether they work for the county, the VFW, the Marine Corps League, American Legion, AMVETS, and I'm going to leave somebody out, and I know I did, DAV, and there are wealth of information out there that's available to them. And like you said, the link that we're going to share later with va.gov will emphasize every benefit that's out there in the booklet that we will actually put out there for them that they can go and read to. Has a host of information.
Great, and we'll include that phone number as well. We are coming to the end of our time, which is a little bit hard to believe because it's passed so quickly, but Robert, I thought that I was going to ask you to share what you shared with the panel before we started as a as a way of closing and appreciation that has been created to show to our veterans the green light.
I thought you were going to talk about how I became so compassionate about this job.
Exactly.
My father being a Marine, but on a better note, about a year ago in New York, there was a program that was started, was called Operation Green Light. It was to shine the light or glow the city green to honor our veterans and their family members. As Pat so eloquently stated, they served as well. I served as a veteran. I'm a family member of a veteran. And in Guilford County, we have already turned some of our buildings green, as some other states have done as well. But what we're also doing, I'm not sure if you can see this, it's an Operation Green Light. Pat, I just forgot what it's called. It's a stress ball. There we go. Tension reliever. And it's something that we're handing out to not only the 400 employees that work for Guilford County, but for any veteran that comes into our office, just showing them that we appreciate them, we care about them, and we love everything that they have done for our great nation, and just to show our continued support.
Thank you. I think that there are so many initiatives, as well there should be, and hopefully we'll all have the opportunity not only to have a heightened awareness after our conversation today, but the ability to participate and really use our voices and our passion as great as we can. And we have a comment that says how lucky Guilford County is to have you, Robert. And I want to second that. And I also have to believe that there are Roberts all across the state and across the nation, as there are Shannons and Pats. And so thank you each so much for bringing your knowledge, your expertise, but mostly your passion. And I know that each one of you have a story, and each person's story is what we really want to hear. So we provide that best care possible. So thank you to the participants as well for joining us, for being a part of our community and really community of service. So thank you. And I want to bring your attention as we continue our Power of Knowing series. We're looking ahead to next month, to November, which happens to be Hospice and Palliative Care Month. And we are going to be focusing on celebrating diversity within hospice and palliative care. And we have a wonderful panel that will be speaking to that issue. And I know that it will be meaningful for all. So please look for that registration information and look forward to joining us on November 15th. I also want to remind all participants that you will be receiving an email tomorrow. It's going to not only have the ability to watch this recording, so you can watch it again, you can share it with somebody who might not have been able to see it, but it will also have a listing of all of the resources with links so that you can access the different resources and be proactive about getting those resources and information. You also can respond to the email if there was a question that you have that was not answered, and I will get back to you just as soon as I can and make use of our panelists as needed. In closing, I want to share a quote, and it was by Daniel Rehnquist, and it says, "All of these things about America, the independent spirit, freedom, and liberty to think, express, and act, the promise of the potential for prosperity, have all been delivered by our founders, our framers, and all who have served have secured this. So thank you to our soldiers, sailors, and airmen." And with that, I will say Thank you for your participation, our panelists for joining us, and I hope that everyone has a safe and good rest of the day. Thank you.
Thank you.